going to do the mononucleosis test, which we're going to use a capillary blood supply. So we're going to stick the end of the finger and then use a pipette for the transfer of the blood onto the cartridge itself. We're going to wash our hands first. For this scenario, we're going to use hand sanitizer. And then we're going to don our non-surgical gloves. I'm going to open up our cartridge. And we're going to put our trash in the trash can. Okay, so now we're going to get ready to puncture the finger. So we're going to find a finger. First, we always clean it with alcohol. This is a sterilization process, so we don't get any contaminants in the blood. Prime it or milk it to pull the blood cells down to the tip of the finger, and then apply light pressure to hold the blood cells at the end. Clean it, and then we're going to use our lancet to puncture the end of the finger. Sharps container. And then using our pipette, didn't puncture. With the pipette, you want to make sure that the blood stays in the nozzle. It does not go to the tip at all. Collect it, hold medium pressure to keep it in the tip, and then transfer it onto your cartridge. The cartridge requires 2 drops of blood. I have to touch it. Touch your pad. There you go. 1, and then 1 more. There you go. Okay, so now we're going to put that into the sharps container. We're going to put a gauze onto the finger, and we're going to add 5 drops of the developer onto the same area that we applied the blood. So we need to focus and count 1, 2, 3, 4, and 5. Remember to always keep the cap turned up. We don't want to put it straight down. So what Miss Charlie was doing was actually holding in her hand to prevent contamination. Cover it so we don't have airborne droplets on it, and then apply the bandage to the patient's finger. This test requires a minimum of 5 minutes. So you will need a watch with a second hand. We're going to fast forward. It has now been at the test result area. If it is a straight line, horizontal, it's going to be negative. If it has an up and down, vertical line, and a horizontal, symboling a cross, that would indicate a positive result. At this point, we're going to consider this negative at the end of our 5-minute waiting period. And we're going to take that cartridge and we're going to place it into the sharps container. And then we're going to remove our contaminated gloves, keeping everything contained inside the glove, and then put them into the biohazard container.